Apollo AyurVAID Hospitals has pioneered a new model of healthcare which is Integrative Medicine and Rehabilitation. What do we mean by this? This means that a person typically comes with multiple diseases. You might think that a person has just one disease, but if you delve in a little deeper, you understand every person comes with multiple issues, right? It could be diseases or it could be functional health issues like sleep, appetite, bowel movement, state of mind, stress, etc. So this whole complement of whole person approach to disease diagnosis. And then what we find, it may be that modern medicine is appropriate for either a differential diagnosis, that is to understand is it this or that. So we refer to a modern medicine specialist where it is required to establish the differential diagnosis using cutting edge diagnostic instruments, followed by putting it all together. So in differential diagnosis, in deciding what part of the health issues can be tackled by modern medicine, what part will be tackled by Ayurveda, and what part will be tackled together. So how does this translate into an effective model of integrative medicine? Ayurveda and modern medicine can come together as adjuvant care, which is during an active phase of modern medicine, Ayurveda can come to support for the lighter, smaller objectives like sleep, appetite, bowel movement, functional health, as we said. On the other hand, once the active phase of modern medicine treatment is completed, Ayurveda can come for tertiary prevention. Tertiary prevention means preventing recurrence of the condition, preventing spread of the cancer, for example, preventing repetition of the heart attack. Further, restoring positive health. It is not just that I survive a surgery, but how do I come back to my original state of good health? And finally, in cases like cancer, looking at enhancing survivorship, living longer, living better, and end of life care. So the whole journey from primal prevention, which is looking at the health of a mother, expectant mother, so that the fetus carried has the maximum life potential, health potential. Looking at primary prevention, how do you ensure that somebody with certain familial risks is prevented from progressing to the disease? Secondary prevention, which is I have the budding early stage disease. How do we work together in ensuring that the early disease does not blossom or does not grow into a full-fledged disease? And finally, tertiary prevention. So this is the spectrum of integrative care. Please understand, integrative medicine is not mixopathy. It is not an Ayurveda doctor prescribing both. Integrative medicine is where an Ayurveda specialist doctor and a modern medicine specialist doctor work together to arrive at a unified plan of care that is in the best interest of the patient and work seamlessly so that the patient is at the center of care. This is a path-breaking global model where we approach it from a whole person approach, integratively, where we address multimorbidities, that is multiple diseases, all in one unified plan of care, leading to path-breaking clinical outcomes. Those of you who are struggling with health issues which are not getting resolved over years, you must try Apollo AyurVAID Hospital's integrative model of healthcare.